The annual World Mental Health Day provides an opportunity to take stock of the progress towards ensuring access to mental health care services to everyone in need. This year, mental health practitioners have pointed out that while awareness about mental health is rising on the African continent, there are still several barriers to access. CGTN's Wilkerson Yabwa reports.
The COVID-19 pandemic, which swept across the globe, highlighted gaps in mental wellness and healthcare in Africa. Mental health is defined as a state of mental well-being that enables people to cope with the stresses of life, and a mental disorder is a clinically significant disturbance in an individual's emotional regulation or behavior.
Any stress will start in an acute level. Then if at all we are not able to resolve this particular stress, it will grow to a level probably of being chronic stress, and eventually maybe give us a mental illness.
Common mental disorders include anxiety disorders, depression, bipolar disorder, eating disorders, and substance-related and addictive disorders. According to the World Health Organization, more than 116 million people across Africa were estimated to be living with mental health conditions even before the pandemic. Social isolation, fear of disease and death, and strained economic circumstances are then reported to have contributed to an estimated 25% global rise in depression and anxiety.
Many people are going through a lot, like depression and fatigue. But according to the mental health perspective, many fear telling people what they are going through.
Genetics, childhood events, or stress can all act as triggers, but treatment is possible. The message that mental health care practitioners would like to send this World Mental Health Day is that mental health care services are a basic, universal human right. However, the World Health Organization has previously found that access to these vital services in many African countries remains inefficient, inadequate, and inequitable. Stakeholders say inadequate financing continues to be the biggest limitation to mental health care provision in Africa. Statistics show that for every group of 100,000 people on the continent, there are only about 1.4 mental health workers. Consequently, the number of Africans who receive mental health treatment is also low. Left untreated, mental illnesses can take a heavy toll.
Mental illnesses have a way of manifesting themselves through our body, what we call the psychosomatic symptoms. Sometimes I'm having maybe depression, and at times the depression is manifesting with persistent headaches.
Many mental health disorders are treatable.
We want people to know that mental health is a normal illness, just like hypertension or even diabetes. If you go through some help, you'll be okay. You'll realize your own potential and you'll live a normal life.
At the end of the day, speak out, stand out, and say whatever you are feeling.
With increased financial investment, campaigners hope to melt away the silence and shame around mental disorders. Wilkerson Yabwa, CGTN.